Hello and welcome back to my channel. This is Stop and Smell the Roses, and I'm your host, Dr. Rose. Currently, I'm a med student, almost done completing my second year, and this is just my channel. This is just a platform I use to take a time to express the amazing things that I'm learning, but more importantly, I find that what I'm learning in terms of in medicine really applies not just to health, but it applies to everything that we do, because one of the beautiful things about medicine, and especially as a Christian, is just seeing the handiwork of God and seeing when we stop and take time to smell the roses, how he's speaking to us through many things, and one of them that I see it in is in medicine. So join me along as we talk about today's topic, and that's going to be on seizures. So seizures, has anyone ever had some twitching going on? Because I know I've had. Actually, just last week I was studying, surprise, I was studying, and I noticed that my left eye kept twitching. And actually, it's to the point where I had a classmate sit across from me, and she's like, "What's going on with your eye?" And I couldn't explain. I couldn't explain what was going on. All I knew is that it was embarrassing, and I needed the twitching rather to just stop. So it leads us to seizures, and seizures are kind of like the brain's way of also having twitches going on. Oh, and here we go. I compiled this analogy. Hopefully it can help us understand a little bit more about seizures. So seizures, this here is like, the brain, and seizures come as a result of too much excitement or due to too little inhibition. And so it's a rapid firing of all of our neurons. This is just a illustration of kind of like how our neurons are. Of course, it's much more detailed than that, but essentially what happens between neurons and the way in which they communicate is through chemicals, neurotransmitters as they call them. And these neurotransmitters are important because as they're being sent through action potentials and through electricity, they send these currents, they send these forms of communication that cause us to increase or decrease in terms of our neuronal synapses. So if we continue down, we'll see that seizures can be separated into partial and generalized. And partial seizures they can further be subdivided into simple and complex. And partial seizures are just focal seizures, and usually they happen in one segment of the brain. Whereas your generalized seizures are seizures that occur throughout the entire brain. And when we talk about treatment for partial seizures, we can use something called carbamazepine. And carbamazepine is going to help regulate those seizures that are occurring in just one area of the brain. And so that's the thing that we have to take into account with seizures. Because it's an overexcitement or because it's little inhibition, we need to regulate with treatment that's going to help enforce some of that disinhibition or that's going to enforce more of an inhibitory effect. And we have our natural form of inhibitory effect, which is through receptors called the GABA receptors. And those GABA receptors allow for an influx of something called chloride. And that chloride, because naturally chloride has a negative charge on it, so when an influx or when more chloride is brought into the cell, or in our case into the neuron, it can then help to leave an inhibitory effect. When we look at generalized seizures, there's different types, but have you ever seen the show That's So Raven? So That's So Raven, if you remember, she was this girl that had the gift of premonition, and she had a gift that she could see into the future. That's so Raven. I used to watch it a lot, but then I noticed that when I watched it more often, maybe that it's just me, when I watched it more often, I would start getting all of these deja vus. And I was like, oh my gosh, I hope I'm not being affected by it. But there's different types of generalized seizures. There's absent, which is it's called the petit mal. And it's just, when we look at the wavelengths in terms of seizures, because again, it's a form of activity that's happening in the sense of we can measure it with frequency. Just like you would measure, sound that's being emitted from a volume, that's being emitted from a speaker rather, in frequency, so we can measure it with that type of frequency. But it only has a 3 hertz spike and wave kind of discharge. And it also has no postical confusion, so it doesn't leave the patient confused, but they do come with a blank stare. So that's why I think about Raven and the moments where she gets that premonition, she gets that glance into the future. She always has this famous stare, and that's what happens. And then there is a drug called ethoxamide that can help to treat it. And so it's important to know this, because with ethoxamide, it's a way that we regulate, and what it does is it's going to block the thalamic T-type calcium channels. So what that means is it's going to stop the action potential from continuing forward. And what's an action potential? An action potential is just it's like a wave of electricity that's going to be deposited or emitted through this neuron, that's going to then lead to some type of action going to lead to an action happening. So you need something to block that channel, or block that action potential from happening, to regulate these seizures. The next thing that we have is something called myoclonic, and then we also have tonic-clonic, which is a grand mal type of seizure. We have tonic, and then we have atonic. And so tonic is just a little bit differently. Whenever you think of the word myo, just in science or in medicine, myo generally refers to muscle. So when we think of myoclonic, it's no wonder that there's repetitive jerks that are also presented with it, but it's more quick. Versus tonic-clonic, which is, tonic means stiffening, which we see here. So it's an alternating type of seizure where you're going to have stiffening and you're going to have movement. So this is usually the type of typical seizures we think about whenever someone says, oh, they've had a seizure, or this person's having a seizure. It's that jerky type of movement that happens with a moment of complete stiffening. And you can use treatments like valproic and phenytoin. And again, these are going to regulate the amount of electricity, or the amount of neurotransmitter that is being emitted into the cell. And then we have tonic-clonic. And tonic-clonic is, like we showed here, it's going to be a stiffening towards the rest of the body. So there's a stiffening in your muscles, but then also the brain activity stops in this case. But one thing I want to point out is that your brain usually doesn't stop. It's always firing. I mean, even when you're sleeping, your brain is still active. And in these cases, though your brain is stopping, the time in which it's happening is so short. So usually it doesn't lead to complete brain impairments for the rest of the patient's life, but in that moment there is some type of cessation that's happening. The next one that we have is atonic, which causes a drop. So atonic, you stop in terms of that stiffening, but it leads you to fall on the floor. And when you see a patient that all of a sudden drops, you got to be careful not to think that they're fainting, because it does still present with that. It still falls under seizures. And then when we continuously have these seizures happening in the course of a patient's life, then we now classify that as epilepsy. So seizures are what can happen, from trauma, as we see here with common causes. It can happen through trauma, through a tumor, generally infections, and an elderly through metabolic type of infections. When it happens consistently or recurrently, then that person is known to have epilepsy. And then status epilepticus, a really interesting name, is just a continuous type of seizure that happens now greater than the 5 minutes. So it happens between 5 to 30 minutes, or it's a reoccurring seizure that may result now in brain injury because it's lasting longer than what is in the normal time frame. And with this, we can use treatments to help. We can use something called a prophylaxis, and a prophylaxis is just a treatment that we give beforehand to help reduce the severity and to help even reduce the reoccurrence of the seizure. And so we use these two famous drugs called phenytoin and phosphophenytoin. And phenytoin, it's a popular drug, and what it does, it's going to block the sodium channels. And again, sodium channels are also what is involved in causing a depolarization for you to then have an action potential within the neuron. And then we also have benzos. Benzodiazepine, and benzodiazepines are drugs that we generally use when it comes to people who deal with anxiety. And we use it for many other cases, but benzodiazepines are going to increase the GABA-A action GABA-A action. And like I said, GABA-A, it's a specific type of receptor, but the GABA receptors generally help to increase the inhibitory response that we have in our neurotransmitters. And so before we wrap up today's Stop and Smell the Roses, I like to end off today with something called Rose of the Day. And the Rose of the Day is from a garden of roses. What is one thing that stands out? What is one thing we can take away from today? And like I said, looking at medicine through the eyes of God and seeing it through God's way of just teaching us, we see that epilepsy and rather seizures are from too much excitement. And so it helps to understand that, you know what, in life, too much of a good thing is sometimes not good at all. And we need not only to look forward to the things that excite us, but we should also appreciate the things that regulate and the things that cause some form of inhibition and some form of control in our life. And we see that that's so important when it comes to seizures. And it's also important in our overall life. Like seizures are because there's too much excitement, and too much excitement from a neurotransmitter called glutamate. But it's important to have those excitement and have those forms of excitatory neurotransmitters. But when it happens too much, we see that it can really harm a patient. And so in this case, we can liken this to a proverb in chapter 25, verse 28, where it says, like a city whose walls are broken through is a person who lacks self-control. So I found this picture on Google. Shout out to Google. I found this picture on Google, and we see that it's a house that is broken in. And now this house no longer has a form of safety. It no longer can be a place where someone can be sheltered, because all of its doors have been able to be accessed. And so the same thing with us when we don't have self-control in our lives. For me, for instance, medicine requires a lot of studying and diligence and repetition and consistency when it comes to learning. And it can be really tedious. And some days it's like, I don't want to do this anymore. I want to be like everyone else. I just want to go out and go have fun. I mean, you look on Instagram, you look on social media, and you see all your friends looks like they're having fun. They're showcasing their time. They're showcasing what they're doing with their time. And it's like, well, I'm always in the library and I'm studying. And, parts of me doesn't want to be a part of that. It's just like, okay, I'm done. But when I really take it in and I see that a city without walls is like a person who lacks self-control, I see that it's important to continue to be consistent. It's important to continue to rule over my desire, even though sometimes I have the desire to want to do other things and studying. I'm not saying that enjoying life and doing other things is not important. It's important, but you still have to have some type of balance and regulation to your life. So the last thing I want to leave you with is, what is regulating you? What, as much as we can gravitate towards what's exciting, never despise to also have in your life things that help to regulate, things that help to bring your life in balance, things that are tedious and hard to do as much as you love the things that are easy to do, because it's only going to help allow you to do what you want to do and allow you to function in the best and fruitful way possible. So that's the rose of the day. I hope you stop and smell the roses and you appreciate all of life, the good, the bad, and the things that you're still trying to figure out what's going on. Love you. Thank you for listening. Bye.